Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This presentation may be used for content overview and clinical competency, and it will cover diabetes mellitus type 1 and type 2. Diabetes mellitus is a chronic disorder of impaired carbohydrate, protein, and lipid metabolism caused by insulin resistance or a deficiency of insulin. There are different types of diabetes mellitus, so the causes and treatments are different. There are numerous causes of diabetes mellitus, and these include genetic as well as autoimmune responses. There are also numerous risk factors for developing diabetes mellitus, such as obesity, lifestyle choices, age, family history, etc. Depending on the type of diabetes, treatment may include insulin, oral hypoglycemic agents, diet, and exercise. The cells of our body need fuel, which is glucose, to function properly. So we eat our food, we convert it to glucose to be delivered to the cells via the bloodstream. The pancreas, which is an endocrine gland, secretes insulin into the bloodstream. And insulin is like a secret key that allows glucose to move from the bloodstream into the cells. And this process fuels the cells as well as lowers the glucose level in the blood. Imagine that someone ate their food to provide glucose for their cells, but the pancreas didn't make enough or any insulin. The glucose in the bloodstream would not be able to move into the cells. The person has plenty of fuel in the bloodstream, but without insulin, the cells can't access it. The person would be extremely hungry and thirsty because the cells couldn't access the fuel they need. And of course, the glucose would just build up in the bloodstream. As the person eats because of the extreme hunger, remember the cells are not getting any fuel. The kidneys would allow some of the excess glucose to filter into the urine as the body tries to cope with so much glucose in the bloodstream. This helps to explain the three major symptoms called the 3 Ps of diabetes mellitus, which are polyphagia, polyuria, and polydipsia. Some facts about type 1 diabetes mellitus include type 1 is often referred to as juvenile diabetes because it is primarily the type children develop, although adults can develop type 1 as well. People with type 1 diabetes mellitus lack insulin or the key to move glucose into the cells because the pancreas no longer produces it. This lack of insulin means the cells can't access the glucose in the blood. Type 1 diabetes mellitus requires insulin and cannot be managed with diet and exercise alone. However, diet and exercise along with insulin can help people with diabetes mellitus maintain a healthful lifestyle. People with type 1 must take insulin in order to live. Diabetes type 1 cannot go undiagnosed for long. Type 1 does not go away, and a person cannot outgrow it. There is an autoimmune component to type 1, and many parents report symptoms of diabetes occurring rapidly after an illness. As the body attempts to combat the illness, it may make antibodies against the pancreatic cells that produce insulin. Some facts about type 2 diabetes mellitus include type 2 is often referred to as adult onset diabetes because it is primarily the type adults develop, although children can also develop type 2. People with type 2 may not make enough insulin, or their body may have developed a resistance to the insulin they do make. They may still make enough insulin to stabilize protein and fat because they convert to glucose slower than carbohydrates, which are the body's main source of fuel. Many people have type 2 and don't know it because they still make enough insulin to survive. They may need to take medication if they cannot control the blood glucose levels with diet and exercise. A severe complication of diabetes mellitus, generally in this case type 1, is diabetic ketoacidosis, or DKA. This is a life-threatening complication of type 1 that develops when a severe insulin deficiency occurs. This often occurs in the early stages of type 1 before a diagnosis is made and insulin is prescribed. It may also be the result of missed injections or an insulin pump failure. When the cells of the body do not have the insulin required for them to access the glucose in the blood, the body will break down fat to try to obtain a source of fuel. The byproduct of this breakdown is ketones, which are acidic. This changes the pH of the blood to become too acidic, hence the name diabetic ketoacidosis. Treatment for diabetic ketoacidosis has many components with just a few listed here. The patient needs rapid infusions of IV fluids. Monitor them carefully because rapid shifts can cause cerebral edema. IV insulin is needed, however, it must be short or rapid-acting insulin. If you're given insulin IV, it's because you need it to work now. NPH doesn't work now. After IV insulin is administered and the blood glucose drops to around 250 to 300, well, dextrose is added. A rapid drop in blood glucose from an elevated level may trigger the body to release adrenaline, which can cause symptoms of hypoglycemia. You'll also need to monitor potassium levels because insulin also works as a key to move potassium into the cells, and the serum potassium levels may drop dangerously low and rapidly. Hyperosmolar Hyperglycemic Syndrome, HHS, is another concern for people with diabetes mellitus. HHS is a complication generally of type 2 diabetes mellitus that occurs when the person has severe hyperglycemia but also has enough insulin available in the body to still move glucose into the cells. Acidosis does not occur with HHS because the body's not breaking down fats for fuel. HHS does not cause the body to break down fats for fuel because the body doesn't need to. Enough insulin is available for cells to access the glucose in the blood. The problem is the blood has way too much glucose. HHS may be caused by poor fluid intake, so fluid replacement plays a more important role than insulin does, although insulin may be given to lower the glucose levels. However, use caution if the patient has or is at risk for heart failure. Hypoglycemia is defined as a serum glucose level below 70. The definition also includes when the blood glucose level was elevated and drops rapidly. Hypoglycemia may be caused by exercise, not enough food, or too much medication such as insulin or oral hypoglycemic agents. Treatment includes administering simple carbohydrates for mild hypoglycemia, glucagon injections, or IV dextrose. After treatment, the client should receive a snack with complex carbohydrates and protein. Simple carbohydrates are recommended for treating hypoglycemia because fats slow the digestion and the hypoglycemia may take longer to resolve. Hyperglycemia is defined as a serum glucose level greater than 110. Hyperglycemia has many causes, a few of which include not enough medication such as insulin or oral hyperglycemic agents, too much food, medications such as glucocorticoids, lack of physical activity, illness, and stress. Treatment includes treating the cause and preventing a reoccurrence. This may require administering medications such as insulin or oral hyperglycemic agents, IV fluids, and adjusting carbohydrate intake. Prevention includes increasing medication dose, adjusting dietary intake, and increasing physical activity. Somogyi and Dawn phenomenon are additional concerns. People with Somogyi and those with Dawn phenomenon have elevated glucose upon awakening, but the causes are different, so of course the treatments are different. Individuals with Dawn phenomenon may go to bed with blood glucose levels that are normal or elevated, and they experience a steady rise in the blood glucose levels throughout the night. So treatment includes increasing the nightly insulin to prevent the elevation. Individuals with Somogyi may go to bed with blood glucose levels that are normal or elevated, and they experience a hypoglycemic episode in the night. The release of counter-regulatory hormones cause an increase in the morning blood glucose level. These people may experience night sweats, terrors, and nightmares. Treatment includes decreasing the nightly insulin and or giving a snack to prevent the hypoglycemia. This, in turn, will prevent the rebound of the blood glucose level. Insulin is essential, so people with type 1 must have it even when they're sick. If they lack an appetite, they still need their insulin injection, but may also need to eat or drink something with a quick source of sugar like regular soda, Jello, etc. Illness and stress can make blood glucose levels increase and can make the levels difficult to control. Your hospitalized patient has many reasons for an elevated glucose. It's not always caused by food intake. Patients with diabetes are at risk for serious complications and should have regular checkups with their endocrinologist and primary healthcare provider. If your patient has ketones in the urine because they do not have enough insulin to move glucose into the cells for fuel, increasing cellular need for glucose by exercising can actually make the problem much worse because they will break down fat faster. Diabetes mellitus can affect every organ in the body and can lead to many serious complications. The complications are caused by excess glucose in the blood, so controlling the blood glucose level can reduce the risk of complication. Decreasing the risk of complications requires managing glucose levels. Blood glucose monitors use a sample of capillary blood obtained by using a Lancet device. Patients with neuropathy should protect their fingers and consider alternate sites for obtaining a blood sample. These include the forearm, calf, abdomen, etc. Urine glucose measurement should not be used to treat blood sugar levels. This presentation is a brief overview only. This presentation may be used for review and continuing education. The care and treatment of patients with diabetes mellitus involves more than this presentation covers. Thank you for your attention to this presentation offered on the Pegasus Learning Platform.